actually we teach it in sociology called the looking glass self. And sense of self is very important because it can be influenced by many, many things. If we look at, for example, the environment we live here today and look at the education system or looking at higher institutions, we can fairly say that the black boys and men don't have enough male mentors, enough black male mentors. And if we further look at the current state of our education system, I mean, we see that there is not a reflection of many black male faculty, okay? And now, that's interesting to look at because the ratio, I mean, that was shown indicates that for every one black male, there is 33 other professors. This is across the nation. Now, if we employ that at Seminole State, it's interesting. I mean, we have 232 full-time faculty, but we only have 3 black male faculty, okay? So, I mean, that's telling us for, at Seminole State Institution, we're looking at for every one black male professor, there's 77 other professors. And the other thing Dr. Gallagher also mentioned is actually, she questioned why the focus was only black men and boys. And she talks about the importance of the role of black women because they play a pivotal role into the society. And again, she explains that when we are addressing systematic, problems, we cannot be singular in our inclusion. And this is where she went on to talk about the elephant in the room. Okay? So that was a brief summary of what Dr. Gallagher was trying to explain before we dive into questions. But compared to Dr. Palmer, he talks about the historic black colleges and universities and the element of success of the black males. And compared to the PWI, the predominantly white institutions, he explains that the historic black universities or colleges tend to have success because they have the community support. And also, the professors tend to go beyond their responsibilities and help support and improve the success of their black students. And also they are positive mentors and role models. And he also addressed that we need to have we need to realize our implicit biases because he was questioned by Dr. Wood. So what can we learn from the HBCU schools to the PWI, the predominantly white institutions? And this is where he explained, he said, most PWI institutions tend to give lip service and not follow through, okay? And it's important sometimes to maybe have some cultural competency training and even also involve our parents to give support to our students on just realizing that black minds matter, okay? So this was a brief summary of both guests that were actually discussed in the weekly meetings. So from now, we're gonna go ahead and dive into questions, okay? Okay. The first question that was asked, okay, it reads, there are a complexity of factors that influence the success of black boys and men. What are some of these factors?
Excuse me. Well, I believe you hit on one very important aspect, and that is a sense of community. And when we find that black boys and men have a group that they have, where they have a sense of belonging, and that within that group they help to strengthen one another. And so I believe a sense of community is imperative for success. And I brought this up once before when we talk about HBCUs in particular and why, maybe some of the reasons why black males tend to be successful at those institutions is that you have a very strong sense of community, and particularly those who are part of fraternal organizations, because those organizations generally have some sort of academic and community service oriented requirements to be able to participate. So I do think a sense of community is one of the reasons that Black males can be successful.
One item that I noted from the research this week, from the presentation this week, was not only the sense of community, but that the community needed to be positive in nature. It needed to be positive in terms of success orientation, and the phraseology that was used was to overcome these barriers with perceptions of opportunity and promise, with an assumption that the student is going to succeed, and that the ideology meant it was not an anomaly when he succeeded. It was an expectation, and that's what the community was centered around, not fighting the barriers, but having a basic sense that he was going to complete, and then how could he do it more easily. And that positivity was translated into a phrase called equity-minded approaches for the college, and that all faculty and staff were important, and that they needed to be multiculturally efficacious. And then there were other discussions by the other presenter that talked about what that efficacious competence might look like, but I'm going to save that because I think that's a later discussion question.
I just had a single question. What about the role, the important role of mentoring in contributing to development of positive attitudes amongst Black men and boys?
Well, that is very important, and you raise a question, and in fact that also talks about the reflection of the Black professors, Black male professors across, at the HBCU schools, and he talked about that. I mean, they have positive role models. I mean, because mostly in the HBCU schools, you have more diversity, of faculty members compared to the PWI institutions. So mentoring will play a great part. But again, like I said, if we apply that to our institution, that becomes problematic, because if you have only 3 male professors out of 232, then the Black students don't have a reflection of their own faculty members. So the mentoring going to be very limited. So it's important, just like Janet just said, when we hire, to hire equity-minded folks all across. All right, I also think about the sense of self that Dr. Gallagher talks about in addressing question 1. It's also important to see how a Black boy see themselves in their sense of self, in the assignments that faculty also give. I think that really tells a lot. It's important to look into those things too.
And so when we talk about the assignments that include Black males, I think it takes some effort and work on the part of the faculty to make sure that that inclusion is not disingenuous, but actually authentic and really touches on important ideas and aspirations of those students. So we talk about the sense of community, the role of mentoring, the culturally relevant teaching, all of that's important, but it's also important to know those students on a personal level. We talk about how Dr. Wood references relationships as being very important, which is what the mentoring is tied to, and knowing those students on a personal level and helping those students, especially at the college level, we have to help students figure out what works for them. And so oftentimes getting to know those students is helping those students also to get to know themselves and to figure out for themselves what will work and what it will take to be successful at this level.
Dr. Palmer had talked about the HBCUs, the historically Black colleges and universities, having an environment that personified the proverb, "It takes a village to raise a child." And that focus on success required faculty members and administrators and staff members to go beyond their formal roles. And I found that an important part of his presentation. If you go beyond your formal role, you are then expressing an interest in the student as a person, not just as a learner in your class, but as a person who might be facing challenges, who might be looking at successes he'd like to share in that particular environment, who might have contributions to make that if you just draw them out, because you are looking for success from that person, you draw out those contributions in the class and the person becomes a class leader. And he had given HBCUs quite a bit of credit for creating that environment.
I think one thing I liked was how he was saying taking it a step forward to be able to kind of almost mimic a HBCU's culture if you are a public white institution. So I think when he was saying also paying attention to how just the website marketing displays its form of diversity to where a student may feel welcoming. Because I think one thing I liked was how he talked about how the recruiting may be very aggressive in the beginning, but once a student kind of attends, the lack of vigor tends to kind of die off. And I think one thing that is very important is to make sure that we are being very intentional about keeping the vigor going once they have been admitted into the institution.
I also want to add to, I believe, Dr. Palmer, since we're talking a lot about HBCUs, traditionally we know that they have really paved the way in terms of graduating black students to getting their degrees. He talked a whole lot, though, when he mentioned HBCUs. I think it was mentioned earlier how if you want to be taught by a black faculty or faculty member, you're guaranteed to have that experience at an HBCU. And Dr. Jobe mentioned that earlier in terms of the importance, and that is also supported by research that, and I say this just about every time we have our discussion, is that research suggests that when students of color are taught and or mentored by someone who looks like them, their level of success in terms of graduation is higher. There were three things that I took away from Dr. Palmer's discussion as he talked about what is it that we could learn from HBCUs in terms of serving students of color. He talked about the importance for all to stop the lip service and provide training. He talked a lot about training to faculty, and he used an example of such training as provide cultural competency training, and a word that many of us don't like, but he said, and make it mandatory. And we don't like that a lot of times, but sometimes there are some things in order to achieve the bigger picture that we must do, and that is something that he really talked about. And then he mentioned in terms of follow through, talk the talk and walk the walk, and I kind of highlighted that as we proceed forward with this work here at Seminole State College.
Okay, so moving forward, so we're going to go to question 2. The question asks, how can educators provide an environment of holistic support for black boys and men? What should that look like?
Well, I think Janet just touched on that when she mentioned that it would require faculty and staff going beyond traditional roles. And I believe several discussions ago we talked about this concept of other mothering, and Turi mentioned that, you know, maybe we should call it other brothering, other sistering, other whatever the case may be, but that it still comes down to relationship, right? So much of what we talk about is about relationship and getting to know people. And one of those things is taking a genuine interest in the success, in the success of our students, to the extent where if we find that the reason they're not completing their assignments is because they're not getting enough rest at night, is because they're having to work extra because they can't work traditional hours due to childcare, then maybe we figure all that out and then provide resources for, okay, well, here are some connections to childcare that might help. Here are some on-campus positions that might help with you earning money, and whatever the case may be. So taking an interest to the extent where we care about the whole person, not just the student, or that we don't see them as just a student but as a whole person.
That holistic perspective brought him, Dr. Palmer, into the area of what that training might look like. And that was problematic for me. I had a concern about two things that he said that I thought were oppositional. One is to make sure that the individual who is being talked about, let's say it's a student, he's poised for success, he's doing well, and maybe a faculty member calls on him as one of the few or the only black students in the room, in the classroom, and says, so what do black people think about this particular issue? And Dr. Palmer cautioned against that an individual of any characteristic should not be thought of as a spokesperson. I found that conflicted with the idea of recognizing individuals' points of view. Because if you are a black man, if you are the only female in engineering class or something like that, if you are the other, you do have a perspective that I think will be valuable if you choose to share that. So that was a point that I think the college should explore further before deciding which way to go on this.
I thoroughly enjoyed Dr. Colton's myth busting with his research. I greatly appreciated, and I think when kind of bringing in some of Barbara's points about the whole other mothering, I loved how he debunked the whole more than household type of situations where basically research will tell you, oh, well, the child comes from a single parent household, therefore the achievement opportunities are lower. And he completely showed how that the social environment that the child will be attending can completely offset the success of the student. So I think that pretty much kind of puts higher ed and all other kind of educational institutions in a different perspective if you can recognize that we hold a lot of weight to the student's success. So regardless of them going to a single parent household or having many other obstacles after hours, if we can make very intentional things, whether it be knowing their names, whether it be very intentional of the person or serving the student as a whole, can pretty much, debunk the success opportunities of that student.
I want to add too, I like what Dr. I believe it was Zamani Gallagher spoke about, and she referenced, I don't know if you all remember this, but she referenced Dorinda Carter from MSU. And what Dorinda Carter wrote about was the importance in terms, the question is, how can educators provide an environment of holistic support for black boys and men? What should that look like? And Dorinda Carter did research on something called critical race achievement ideology. And as we were watching that particular segment, it started with three significant percentages that denoted black males. The first dealt with high school completion in comparison to their contemporaries. The other statistic dealt with those black males entering college. And the third statistic dealt with black males who graduated from college. All three of those statistics, black males were behind every other person in in terms of comparison. But what Dorinda Carter studied, and she talked about critical race achievement ideology. I want to throw in a new scholar who I had the chance to research as I was completing my dissertation on this topic, and it was D.L. Duke, and it goes hand in hand with what Gallagher talked about and what Carter was talking about, and D.L. Duke, for those of you who are interested in other studies, wrote about can within race achievement comparisons help narrow between race achievement gaps. In other words, what Carter was discussing, according to Seminole Gallagher, critical race achievement ideology, and Duke, I came to the conclusion that it is time perhaps for us to begin to paint a better picture on the academic successes. Because if we don't do that, and if all we're doing is talking about retention and the retention failures, then we're only talking about a one-sided program, and that's failures. We're not talking about those who are actually at the community college and who are performing academically well. As I conclude this, Duke mentioned that when we begin to frame a better picture, and this is in line with what Palmer discussed and what Carter was talking about in terms of critical race achievement ideology, this is what we're doing. We're acknowledging the greatest benefit when studying within group achievement provides a deeper analysis of a problem by explaining the existence of the problem as well as excluding other explanations through a process called framing. Because the concept of framing has been utilized by communication studies forever and ever. The framing of a problem is often turned into a casual story. And so in terms of telling the entire story, it is important as it is we must talk about retention because that's why we're here. It is an issue. We have not closed the gap. I don't even know if we moved the needle enough to even close the gap, and that's why we're having, and this is not just for our college, but this is a crisis nationwide. We're not in this battle alone. But at the same time, it is important to reframe this issue, to also talk about the academic successes, because I think, is there a myth? Are our students only seeing failures? I don't know. What are they seeing? Who are they seeing? If other black males at this institution is saying, we're not graduating, hey bro, what's up? You're not graduating either? I say that is not the truth. According to research, we have to reframe our message. And we can start here at our institutions in terms of moving forward. How do we tell those stories of successes? Hopefully that will catch on. Because right now, perhaps, I don't know, maybe that's all they're seeing is we're not graduating. I'm in this group for boys, we're trying to get you to graduate. Of course, we're trying
Check, check, 1, 2, check. 1, 3, check.
It's a 30-second delay.
I know, I was impressed.
They just saw you for 30 seconds.
That's awesome. Okay, gang, remember we are in full-on clinical mode, so that means, ladies, if you do this and your hair falls in front of you, it needs to be up in a bun. So please remember, tattoos need to be hidden, all that fun stuff. Okay, again, ladies and gents, we are on full-fledged clinical mode right now, so that means if hair falls in front of you, if you do this, you bend forward, and your hair is going to come in front of you, it needs to go up. Tattoos need to be hidden. You need to look like you're going to clinicals, because this is a clinical activity that we're doing right now. Thank you. Okay, guys, again, we're going to get started in just a couple minutes. We are in clinical mode. We do have a representative from the hospital here. So that means if hair is going to fall in front of you, if you lean forward and your hair is falling in front of you, it needs to go up into a bun. If you have tattoos or anything like that, or anything else on your uniform that wouldn't be there in a clinical setting, please make sure it goes away at this point. So we look professional. They will be taking photographs for your badges after this is... That's why you're in uniform. So again, make sure you look presentable, because that is going to be your Florida Hospital badge picture throughout the program. Okay, everybody, we are going to go ahead and get started. So hello to the folks upstairs. That means no talking at this point. So we are going to go ahead and get started. Hello to the folks up in 346. So I'm going to introduce Alexis Morano. She is a Florida Hospital, Advent Health employee. She's also a Seminole State clinical instructor. So she knows the drill very, very well. She's more than happy to incorporate that. So please give her a warm welcome and give her your attention.
Thank you so much. Good afternoon, everybody. Yay. Everybody had their coffee, right? Yeah. I'm so excited to present here about how to be successful at Advent Health. If I say Florida Hospital, sorry. Yeah, so a little bit about me. So I've been an employee of Florida Hospital, or Advent Health already, started off with it, for over 6 years. Currently, I am the Nurse Residency Program Manager. So once you get, you're like, I go through the program, I pass my NCLEX, you apply for a job at Advent Health, you could apply for our Nurse Residency Program. Lots of fun. We really want to make sure you're successful in your transition. So I'm responsible for that program. As Dr. Theodore did say, I am an adjunct clinical instructor here at Seminole State. I've done it for 5 semesters. I'm currently teaching AMS, so I might see some of you. So you never know where our paths will cross. So we're going to talk a little bit about how to be successful for clinicals at Advent Health. So in the beginning, so Advent Health Orlando, so that's the name of our system now, started in 1908 as the Florida Sanitarium. So there was quite a need to take care of tuberculosis patients and whatnot. And through that and through our growth in the Orlando region, we've developed into Florida Hospital. Now, as of January 2nd, 2019, we are known as Advent Health. So what does that mean? Because there's probably been a lot of confusion. Did they get brought out? What does it mean? Is it new ownership? And the answer is no. Bless you. So Advent Health, so a lot of you probably wouldn't realize that Florida Hospital was part of a national hospital system called Adventist Health System. It's in about 8 to 9 different states, close to 50 different hospitals. So let's say for whatever reason you're in Kansas and you went to Shawnee Mission. You wouldn't have realized that was our sister. So in an effort to align to make it a national brand, that's why the rebranding of Advent Health came to be. So we're the same mission, vision, values, everything's the same, just a different title. So with Advent Health Orlando, we entail so many different campuses. So we have Altamont, we have the Walt Disney Pavilion, we have Orlando, which is our flagship, or the mothership I like to call, because it's huge and I always get lost. We have Apopka, Kissimmee, Celebration, East Orlando, Winter Park, as well as our freestanding EDs, those being Winter Garden and Lake Mary, with more to come. So as you can see, we're constantly growing, and we're kind of known throughout the Central Florida region. So who are we? So our mission has always been to extend the healing ministry of Christ. So you're thinking about that, and our organization is Seventh-day Adventists. But I want you to not think about extending the healing ministry of Christ for its literal sense. Think about, what does it mean to you? How do I want to extend that? Is it through treating my patients with uncommon compassion? Is it through treating them like I would want my loved ones? So at Advent Health, you'll see all of the employees have this little heart badge. So it says, I care for you like my ... So always keep that in mind, because you want the care to be that of representative of what you want that your loved one to be. Vision. Our vision is to be connected, holistic, kind of a nice pun on words there, affordable, viable, and exceptional. So that is our direction. We want to be the best. We want to provide high quality of care, but being mindful of the expense to our patients. And finally, our beliefs, our values. So we always value quality and service excellence. So when you think about that, you want to be the best. You want to provide that excellent care, community well-being. So as you could see, Advent Health is huge in the community. We do a lot of volunteerism, a lot of charity work. So that's super important, because who is our main customer? The community. High ethical standards. Do you want to have a nurse that doesn't, document correctly? No. Stewardship. So we want to be conscientious of our resources. So we don't want to waste. Gone are the days that we're wasting unnecessary product. We want to be very conscientious. Should I use this over that product? And inclusiveness. So when we take care of our patients, we're taking care of them all the same. We're including them in their care. So we have our service standards here. These are actionable ways that we live out our mission, vision, and values. And they're super easy. There are 4 service standards. Keep me safe. Love me, make it easy, and own it. So when you think about it, think about those 4 in the grand scheme of things. If I was a patient in a hospital, I wouldn't want my nurses to take care of me like that. Now think about your fellow coworkers or your fellow colleagues now. You want your colleagues to make you feel safe. You want them to love me. It doesn't have to, you want to make sure we have each other's support. Make it easy. If there's a more efficient way, we're going to share it with others and own it. We're going to take responsibility and accountability for our actions. So this always entails every person, every time. So creation health. So being an Adventist, a Seventh-day Adventist organization, health is viable. It's, kind of what our forefathers, really preached upon. And one of those is creation health. So each of the letters of creation spell out a key component that we have to entail. So C is for choice. So that's the choice. So let's think about patient care. That's something that we want to give them options. Because quite often when you think of the hospital, it's kind of dark and gloomy historically, right? We're kind of getting away. They can't really choose when they want to sleep, eat. We're telling them we have to do your lab draw in the middle of the night. It's kind of just really dark and gloomy. We want to get rid of that. So C is choice. Maybe giving them an option. Hey, do you want to do your incentive spirometer before or after your pain meds? Maybe, I know you've been getting that, dull meal house tray from the cafeteria. Maybe let's call down to the nutrition and see if there's another option. R is for rest. So let's encourage rest, because we all know when we're not feeling well, what's the first thing we want to do? We want to sleep. If somebody said run a marathon, I wish I was one of you. So you want to rest. So maybe administering that pain medicine to encourage rest, because we don't want our patients to be in uncontrolled pain. E is for environment. And it seems silly, but it's something to be conscientious for. How many of you have sat during a lecture and it is cold and you're like, uh-oh, this does not feel good. So think about that with our patients. Could we increase it? Do we give them more blankets? How do we make their environment conducive to their healing? A is for activity. When to ambulate? When do we tell them to turn, cough, deep, breathe? So little things like that, because we know that rest is important, but we need to get our patients up out of bed ASAP. Trust in God. Do they want a religious advisor to visit? So a lot of times you're like, well, my patient's Jewish. At Advent Health, we're all inclusive. So let's say for whatever reason your patient is Jewish and they're requesting a rabbi to see them. We have a great partnership with the local religious organizations where they will get a rabbi from a local synagogue to come in pray with the patient. So just definitely keep that in mind. Even though we are Seventh-day Adventists, we have so many other resources at our disposal. Interpersonal, staying in touch with their support system. So thinking about your patients, sometimes, how many of you have worked in healthcare before? Okay, quite a few. And how many of you have taken care of that patient and they're just mean, 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 and you do everything, you try to kill them for kindness, but they're just mean. But then sometimes you just sit down and you start talking to them and you start realizing that their support system is not the greatest at home. That's all that interpersonal. And when you think about patients in the hospital, they're kind of at their worst. Most times in the hospital, they don't select to come. There's chest pain or something, unless it's labor and delivery, which is usually a happy place where they're like, okay, yeah, we're gonna deliver this baby. But, usually adult inpatient, these patients are at their worst. How is their support system? How can we facilitate that? And the support system could be anything as a family to even a friend. So just definitely keep that in mind. And finally, O is for outlook. You're gonna discuss those expected outcomes. See how their outlook is looking like. So thinking about that with your outlook, a lot of times we wanna go and say, we're gonna discharge you on these home meds. And then your patient's like, I don't know if I could afford these. They kind of have a poor outlook. But then you could extend that healing ministry of Christ by saying, you know what, let me work with the care management team and see if we could find maybe more affordable options for you. So that's all on that perspective. And finally, nutrition. Good nutrition promotes healing. And when you think about these creation health principles, they not only apply to the patients, but us as well. And I know, being a nurse, we often don't promote self-care within ourselves. So being students, please, embody these principles. They're very easy. Make sure you're getting enough rest, that you're doing some sort of activity, whether it's hanging out with your friends, exercise, anything we could do to make sure that you are one with God and as well as, with your patients. So accreditation. So a lot of you probably working in healthcare are familiar with the Joint Commission. So the Joint Commission's an amazing accrediting body, but they focus strictly on medical. So back in the day, Advent Health had Joint Commission, but back in 2011, they're like, that's just only a piece of the pie. We want to strive for excellence in all aspects of healthcare. So when you think about healthcare, it's not only patient care. So we have things as maybe, how's the electrical work? How's the plumbing? How's nutritional services? Those are all key components that we want to make sure are top notch because it's indirectly affecting our patients. So they then sought out DMV, Diagnostic Veritas, and I probably butchered that, but, but we lovingly call them DMV. So the cool thing with them, they started out as a shipping inspection company out of Norway back in the 1800s. So some of you probably know about shipping. I'm not well versed in it, but when you think about shipping, you want the ship to be up to highest standards because once it's out to sea, if it breaks, it breaks. So the same thing, and they've done that with all different kinds of industry, and they tapped into healthcare. So that's our accrediting agent. So let's talk about HIPAA. How many of you are familiar with HIPAA? How many of you violated HIPAA? Kind of hard. It's kind of easy to violate it. So we always like to talk about HIPAA because it's super easy to indirectly disclose patient information. I've been there, or I've been with my students. So I do clinicals at Altamont on Sundays. So this last Sunday, you're thinking, oh, this is so cool, and then all of a sudden you're going to the elevator. You want to start talking the rest of the story. You're like, and it's super hard. But you always have to be mindful of, you don't know who's in that elevator, who's in that cafeteria. So definitely when you're on stage, which is kind of 95% of the hospital, you want to maintain your HIPAA. But of course, if you're in pre-post conference, in a break room, in a med room where you want to share your excitement and your story, please do share that because you're going to see a lot of great things in a hospital, but just be mindful of that patient information. Just imagine if you are a loved one and you're in the cafeteria and all of a sudden you hear the nurses taking care of maybe your aunt and they're like, oh my goodness, she is so difficult, and start blabbering away. Would you want that? No. So just keep that in mind, and don't take any protected patient information home with you. So I know you're going to have a lot of assignments where you might have to go into patients' charts. So remember, you could only access it while you're there in the hospital, you cannot take anything that has any patient information. Just keep that in mind. So communication. So at Advent Health, we kind of do a streamlined form of communication, and that's in the form of eye care. So we'll go over each letter so you understand what it means. So anytime that you go into a patient's room or interact with a patient, you want to introduce yourself. Because if I walked into this presentation and didn't say anything, you'll be like, who is this girl talking to me? Right? So you always want to introduce yourself. So have your badge readily accessible. That's key number one, and that's part of your clinical uniform. But you want to tell people, hey, my name's Alexis. I'll be your student nurse for today. Captivate them. Introduce who you are. Next is you're going to connect. So how many of you have been a patient, maybe in a doctor's office or maybe in the hospital, and the doctor just went in and out, didn't really get to know you? I've been one of those, right? I'm very fortunate that my primary care provider embodies eye care, because each and every time he asks me, hey, how are you doing, Alexis? How's your husband? So kind of that connection. So going to the clinical arena for the first time, you might be like, how do I spark that conversation? Look around the room. A lot of times patients have photos there, or maybe you see, you know, they have a family member. Who is this that I'm speaking to? Or so just definitely keep that in mind, engage with them, because when they start talking about themselves, you're able to better connect with them. A is anticipate, so anticipating their needs. So at Advent Health, we do something called hourly visits. So each and every hour, either the nurse or the patient care tech will go into the room and assist the patient with their needs. So instead of saying, you know, I'm just gonna go and do one thing, and all of a sudden 2 seconds later they ring the call light. And does anybody have time for that? No. So kind of anticipate their needs, so kind of proactively meet their needs. And we'll talk about that momentarily. R is for reinforce. Reinforce what you're gonna do. So hey, we're gonna ambulate at this time, or hey, you want some apple juice? I'm gonna come right back with that. And E is extend. So even though your work might be done, you always wanna close with, is there anything else I could help you with? Because just imagine if a nurse came in, oh, here, we're done, and didn't say anything, and you're like, oh my goodness, I have like a whole list. How would that make you feel? Kind of just isolated, like nobody wants to. So this is kind of a cool framework that we use for all disciplines at Advent Health. Very easy, sounds a little bit cheesy, but just keep in mind, those are the key components whenever we're communicating with any provider, patient, anybody that we encounter. So our communication tool that we utilize is today's plan. This is super cool. So every shift, the patient will receive this today's plan. It kind of engages the patient. So it tells them about which doctors are on their case, what medications they have ordered, about any tests or procedures. But it has two cool things I like about it. It has a place for questions for your doctor. So how many of you have been to a doctor and all of a sudden you got white coat syndrome and you're like, I forgot what question I was gonna ask. I've been there, right? So it allows them to jot down those questions. And you, even as the student nurse, maybe your patient says, hey, I have questions. I want to ask my doctor these questions. You could jot them down, okay? And then it also has, what's the most important thing I could do for you today? So that's super important because we want to provide personalized care. So some people might be like, I just want an ice cream. Write that down. So little things like that, and you'll see the nurses doing that. And we also end with a Creation Health daily message. Interpreter services. So how many of you are fluent in another language? You're like, oh, this is super cool. Could you interpret? No. So if you're doing patient care, that's fine because you're just saying, okay, I'm doing your assessment, but you cannot interpret. So that becomes really important for consent. If a physician says, oh, you know how to speak Spanish? Do you mind interpreting all this stuff, this plan of care? You're like, no. So we made it easier. We used the Stratus interpreter. It's really cool. See, each and every unit has an iPad, and it's basically like a FaceTime where it will be right at the foot of the bed, and the patient will be able to hear the interpretation. Super cool, a bunch of different languages. I'm telling you, this is way better. Back in the day, we used to have 2 blue phones. It got really confusing. This is FaceTime. It's really cool. And this is great for even your confused patients. At least they're not like, hold on, I have to hold a phone. So just be on the lookout for that. But remember, do not interpret. Patient identification. So at Advent Health, or it's kind of universal, we always use 2 patient identifiers. Is the patient room used as an identifier? No, because patients could easily change rooms. So we always use patient name and date of birth. And what happens if your patient is confused or nonverbal? How do you check for their identification? Bracelet, and you check it against the chart. So each and every time that you first walk into the room, identify. When you're about to give medications, identify. And the patients are like, really? But you want to make sure that you're in the right patient's room, because it's super easy. Some of the units look exactly the same. You accidentally go into room 13 instead of 14, and you might accidentally give a wrong medication. So hourly visit, so tying into what we were just talking about. So every hour we do an hourly visit. So we abide to the 5 Ps. First one being pain. So you might not be giving the pain medicines per se, but you, as a student nurse, you could ask the patient, hey, how's your pain? Are you comfortable? They're like, you know what, I'm kind of due for my medicine. So each and every room, patient room has a communication board, and one of the things that says is their pain goal as well as when is their next dose of pain medicine. So even though you're not administering it per se, you could participate and be like, you know what, I see that you're due for pain meds in 20 minutes. Let me go and let your nurse know. Or, hey, I see that you're not due yet, but I see that you're in a lot of pain. Let me go and ask your nurse. P is for potty. So you could assist your patients to the restroom. So you want to always ask the patients, hey, do you need to use the restroom? And especially for our very confused patients, you're like, let's just go and we'll help you out. P is for position. As a student nurse, that's something that you could easily do, right? Hey, are you comfortable in your position? And I don't know about you, how many of you worked with those hospital beds, and no matter how big or small the patient is, they always tend to be like squished in the middle, they slide down. So you could help participate in that. And anytime that you're doing your position or your pottying, be smart about it. And that, what I mean is, if you're like looking at the situation, you're like, that might be a 2-person assist, do not do it by yourself. Grab another peer, ask your nurse, because I don't want you, the patient to fall, but most importantly, I don't want you to hurt yourself. So be smart, it's better to roll with them. Let me assess the situation, let me ask my nurse before I take this patient out. P is for periphery. How many of you love dirty rooms? I get you, right? So always look at the environment. Make sure it's nice and clean. Are there any fall hazards? Not only for our patients, but for our guests, for even ourselves. And then finally is partying. Explain that you'll be back, right? So I'm finishing my hourly visit. Is there anything else I could grab for you? I'll be back within the next hour. So 5 key little things that you could do, and it really reduces the amount of call-outs, because these are kind of the 5 most chief things that patients are going to often use that call-out for. Because ultimately, we want to address those needs so they're able to get that rest. We're not interrupting their time with family. So voice of the customer. So we have to talk about our patient surveys. So I know a lot of times there's been a lot in healthcare of there's so much focus on patient experience and what does that entail? But the truth is, who is our consumer? The patient. And we want to make sure that they're receiving top-notch care. Also with our patient surveys, this is important for reimbursement, because we want to be able to have enough resources to be able to give that top-notch care for our patients. So they use different surveys such as Press-Ganey, HCAHPS. How many of you have seen the HCAHPS? How many of you completed the HCAHPS? It is about 6 pages long. It's very long, but it goes over everything on their care. So we're gonna go over some of those questions on the HCAHPS, so at least you understand what our patients are surveying us. So the first one that we're gonna go over is communication. So during this hospital stay, how often do the nurses treat you with courtesy and respect? So you're like, I would hope always, right? During this hospital stay, how often do the nurses listen carefully to you? During this hospital stay, how often do the nurses explain things in a way that you could understand? So throughout your nursing school career and eventually being an RN, we get really excited and we're like, oh, I know all this medical terminology, QI, TID, ACHS, but we have to put the brakes on that. That's super important when we're communicating amongst each other, with physicians, other healthcare providers. But does our patients necessarily understand what HS is? ACHS. So definitely keep that in mind when you're explaining things to your patients. You might have to tone it down a little bit, but of course gauge your audience, because you want to be able to make sure that they understand what you're doing, what your intent is. And a lot of times people are like, well, I'm just a student nurse. They're going to remember you as a nurse. So just keep that in mind, that you're going to play a pivotal role in their care as well. Communication with doctors. So not only we talk about nurses, but also with doctors. That's kind of part of our scorecard. We have responsiveness of hospital staff. During this hospital stay, after you press the call button, how often did you get help as soon as you wanted it? And then how often did you get help in getting to the bathroom or using a bedpan as soon as you want it? So I always like to abide to the no pass zone. So even if it's not your assigned patient, if you see the call light, attend to that. You might not have the solution, but at least that patient knows, hey, somebody attended to my needs, you know, they're just not leaving me. Because how many of you have been on a hospital unit, all of a sudden you just hear the call light go ring and ring and ring and ring. Even though it might be 2 minutes, 2 minutes might seem like 2 hours for our patients. They're not feeling well. So just definitely keep that in mind. If you see a call light, attend to it. You know, maybe you're able to rectify the situation. If not, you know, get the nurse, the PCT, whoever you need to help this patient. Rating. So we also talk about over a hospital rating and ultimately willingness to represent. It goes over other things, but those are kind of the key components. We also talk about pain. So like I said, you're not going to be administering those narcotics, but you could help with some non-pharmacologicals. Reposition, maybe you could dim the lights, music, little things like that. So here are some things that our patients have said on their surveys about student nurses. There was a student nurse, Erin, very helpful and had good side manner. Enjoyed visits from student nurses. They were both capable and polite. All the nurses were great, but special attention goes to student nurse Amanda. She was wonderful. So just remember, you're just not a nurse, you're just not a student nurse. And I teach clinicals, so each and every week, I can't stress the times that the patients love being with the student nurses, because you provide that undivided attention and they enjoy being able to converse and connect. So just keep that in mind. Your patients are going to remember you. So let's say, for instance, things don't go our way. Maybe you walk into the patient's room and all of a sudden they start screaming. I don't understand why my pain meds haven't been delivered. What's going on? Nobody's listening to me. So you might be part of that conversation. You're like, I'm coming in to introduce myself. So we have something called ACT. It's a model that we utilize for service recovery. So each of the letters encompasses something that we do to rectify a situation. And this could be applied to any customer service setting. So a lot of people are like, healthcare is not customer service. Yes, it is. Because you're interacting with other people. So A is for acknowledge and apologize. So you know for sure, you're like, okay, I didn't cause this, but you want to acknowledge. So you're not going to say, I'm sorry that happened. You're going to say, I'm sorry that that happened. You're not going to say, I'm sorry you feel that way. You want to be kind of objective, because you want to say, hey, I acknowledge that I'm sorry that you're in so much pain. C is for correct. You're going to tell them what you do. You might not have the authority to call the provider, but you might say, you know what, I'm going to let your nurse know so we could maybe find a solution. And then T is for think. So this seems a little bit awkward, where you're like, think? So think about it. It could be, hey, thanks for bringing it to my attention. Thanks for being patient with me. So these are key components that we do for any service recovery at Advent Health. SBAR. How many of you have got to practice with SBAR already? Probably not yet. So SBAR is the formalized tool that we utilize to communicate. It sounds a little foreign, and that's okay, because you all have plenty of time to practice it. But once you get the hang of it, you're like, I got this. So anytime that you're communicating with a provider or maybe amongst each other, S is for situation. So that's where you're going to captivate your provider's attention. Maybe eventually you're going to work overnights. And you're like, uh-oh, I have to call Dr. Smith at 3 in the morning. He's going to wake up and be like, what do you need? So you're going to captivate his attention. Hey, patient's short of breath. Or patient, blah, 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 blah. B is for background. You want to tell the physician or the provider a little bit about the patient. because they could be short of breath, but if the provider didn't know that, hey, patient's been admitted with pneumonia, you know, that's pertinent. A is for assessment. This is your time to justify, hey, my patient's short of breath as seen by these assessment findings. And R is for recommendation. So a lot of times people are like, I'm not the provider. But you kind of need an idea of why you're calling the physician. You might not know exactly the dose or the amount, but you're like, hey, patient can't breathe. He probably needs some sort of breathing treatment. So it's a universal tool that we utilize. It was had some background in the military had created it. So fun fact. So safe medication administration. So whenever you pass meds at Advent Health, or any institution for that point, is super important. You're going to communicate with your patient's assigned RN prior to administering the patient medication. So I know in your first semester you're not going to be passing meds, but like for BMS and on, you'll be passing meds. So kind of your clinical instructor will kind of assign you some patients. Hey, this is your patient you're going to pass meds with. But it's your responsibility as the student to tell the assigned nurse, hey, I'm passing these meds at these times for these patients today. Anytime that you're administering medications, you always want to use the 5 rights. Even though you've been in that patient's room 5 million times, or even you're like, oh my goodness, this is a routine medication, you always want to be safe. And all students administering medications must be directly supervised by faculty. I cannot stress that enough. You need to have a licensed person, and as in your earlier semesters, it will be with your clinical faculty member. So I get a lot of the questions, oh, but my nurse is going to give medications. She's going to witness. The answer is no. So just keep that in mind. You could witness the med pass, but you cannot administer it without a clinical staff member there, that being your faculty adjunct. After giving the medications, you're going to verbally notify the patient's RN after administering the medication. You're going to include the patient's response in communication. So it's kind of that closed loop communication. You told Sally, the assigned nurse, hey, I'm going to give the medications. After you administer those medications, you're going to tell them, hey, I gave the medications. Because ultimately, who's responsible for this patient still? Sally, the nurse, right? We're just assisting. And all documentation must be performed in the EMR and authenticated by the RN that is directly supervising. So once you go into your clinicals with any documentation, they'll go over that process because your faculty member has to make sure that what you're putting in the chart is true, is correct, but also, you know, we're dealing with patient's charts. We're not saying, oh, this is cool, I'm just gonna click whatever. We wanna make sure that the legal record's correct. So what could you not give? So you can't give any continuous narcotic or opioid infusions, PCA, any IV push medications. And I always like to say, once you push one IV push medication, it's the same experience every other time. You'll do plenty of that when you're on the floor as a registered nurse. Any epidural, any chemo, peritoneal, kind of high-risk medications. And as a student nurse, do you want to be even thinking about these high-risk medications? No. So work with your faculty member. They know exactly what medications you could give. But once you get checked off, you'll be able to do sub-Q, IM, IV piggyback, PO, so you'll have plenty of opportunity to give medications. Just with these high-risk medications, we just want to make sure it's designated towards those trained RNs. Infection prevention, because we want to make sure that in every patient's room we provide clean care. So the 5 moments of hand hygiene. So we always want to wash our hands. Please do so. First thing, before touching the patient. So as you enter the room, let me foam in, right? Next, before any clean or aseptic procedure. So a lot of people think, oh, I'm going to put my gloves on. You better put your foam up, then glove up. After any bodily fluid exposure, that kind of makes sense. After touching the patient, common sense, but you know, we often forget. And then after touching the patient's surroundings. So anything in that environment, you want to foam up. So it's not only to keep you safe, but also the other patients, because as a student nurse, you might be going into maybe 10 patients' room quite often just because you're kind of helping them out with vital signs, you're kind of learning, you're growing. So just keep that in mind. You don't want all that germs transmitting. So our alcohol-based hand rub, so it's kind of the foam that you'll see, is the preferred method for hand hygiene. All except for when your hands are visibly soiled or if you're in a C. diff room. Use normal soap and water. And a lot of times people are like, well, that foam gets kind of caulky over your hands. After a couple of times, wash your hands, but always remember, foam up, foam out, and in between. So this is a cool statistics, kind of scary, but gloves with hand hygiene leads to clean hands. Gloves without hand hygiene, so we're thinking, oh, we're being smart, we're being, infection prevention. It's only 70% effective. Do you want to be 70% effective? You want to be 100% effective, so just keep that in mind. So preventing bloodstream infections. So at Advent Health, we do for our central line dressing kits, we change the dressings every 96 hours. So as a student, you might not necessarily be doing that dressing change, but you might be observing it. We take it so seriously that during the dressing change, everybody in that room, so the patient, visitors, you, the nurse, must wear a mask because we want to help prevent any central bloodstream infections and line access. So maybe towards later on, you might be having to help with an IV insertion or starting an IV piggyback. You always want to wash your hands. I recommend anytime that you're touching bodily fluids, including the IV, glove up as well. You're going to scrub the hub for 10 to 15 seconds with an alcohol swab and air dry. How long is 10 to 15 seconds? Is it a short time or a long time? It's a long time, so sometimes you might be like, let me look at the clock. Time it. It's super long when that's the only thing that you're focusing on. And you might also see, depending on where you're at, alcohol impregnated caps. Those are called the Kuros caps. They're green little caps that we put for any central lines or maybe in the ICUs as well. So keep a look on that, but it's serving the same purpose. So what about indwelling urinary catheter? So maybe later on throughout your clinicals, you might be able to insert that first semester, towards the tail end of second semester. I have background knowledge. Some of you are like, oh, I get to know. But we make it super easy with the Foley catheter is that we have a really cool kit. It's kind of foolproof. It's numbered to tell you exactly which step. If you have an opportunity during your first or second semester to observe one, please do so you can see how the kit really helps you out. So anytime before we insert a urinary catheter, we're going to do CHG prep. So it's an orange foam, it's chlorhexidine, and it just kills any of that bacteria. Because when we think about inserting a Foley, is it a clean region? No, it's pretty dirty. So we do that. Then we're going to do aseptic technique. So we're going to insert it, and then we apply the stabilization device. So you might participate in inserting the Foley catheter. So just definitely keep that in mind. It's aseptic. We want to make sure we don't have any caudis. Because is it a great thing to cause a UTI? No. So this is where most of you might be really participating. Maybe a patient already has a Foley. How do I take care of it? So we always clean the catheter twice a day using the CHG, the chlorhexidine. So you might participate in doing that. So let's say, for instance, your nurse delegates that to you. Hey, you're going to go and change or do Foley care. And you're like, what does that entail? Ask, because you don't want to always assume. And that's any nursing skill. Ask, be like, okay, I don't know what you mean. And then you're able to do it. And soap and water as needed. We're going to keep the system closed, below the level of the bladder. So what happens if we put it above the level of the bladder? What's going to happen to that urine? So just keep that in mind, because you might walk into that patient's room, maybe they were recently transported. Transport has to put it up on the bed just for ease of it. Maybe they forgot. Take it down. But remember, do not put it on the floor. So it's kind of that balance where you're like, okay, hold on, where do I position it? And at Advent Health, or I could say nationwide, we're really big on discontinuing unnecessary Foley catheters. We want to get them out as soon as possible. Back in the day, they put Foley catheters on everybody. But now you might not see as many Foley catheters just because we want to reduce our occurrence of urinary tract infections. So infection prevention with multi-drug resistant organisms. So we have superbugs. So you might take care of some patients that might have some superbugs. I've done so already. And you're like, hold on, what could I do to prevent that transmission? So you're going to abide your hand hygiene before and after room entry each time. You're going to abide to contact precautions. So at Advent Health, that entails a yellow gown and gloves. There's other precautions that you might see as well, that being droplet, so that's going to be a mask, airborne, all of you should have your fit testing already with the duck bill that you can't breathe, but those are different precautions. And some of your patients might have multiple precautions, so keep that in mind. There's always a sign on the front of the door to tell you what kind of precautions that you're going for. So always remember to abide to those, because sometimes people, and I've been guilty of that, oh, I'm just gonna be in that patient's room for 2 seconds. If they're in isolation, they're in isolation, because we wanna also keep not the patient safe, but also ourselves safe, as well as any other patients and visitors. Flu vaccine. So we're in the midst of flu season, if you didn't know already. So all of you are gonna be required to have a flu sticker if you already have gotten the flu shot. So it should look something like this. So when you get your badges, they'll tell you on how to acquire said flu sticker. So if you have it, great. But let's say, for instance, you want to decline it. That's okay. Nobody's here to tell you to have it or not. If you do decline, you're going to have to wear a mask at all times while in any patient care area or when transporting a patient between December to March. So just keep that in mind. It's okay if you refuse, but just know that you would have to wear a mask otherwise. Fall prevention. So each and every shift, we do something called the Morse Fall Scale. So probably you're going to learn that later on in the semester, because we want to assess our patient's risk of having any falls. So the higher the score, the higher the likely that the patient's going to have a fall. So you might not be physically doing this per se, but you might be working with your nurse to develop a plan. Maybe you have that confused patient all the way in that corner room. You're like, that's not a good idea. Maybe you're going to help get them close to it. Put the yellow socks, put a bed alarm. You're still, as the students, you guys are amazing because you're able to help with those high fall risk patients. Maybe the patient's so confused that he's just so antsy that we need to ambulate around the unit. So those little things that you can really help with keeping our patients safe. So another interesting fact. So who falls? So see this. So 61% of people who are alert prior to falling. Does that surprise you? 40% of individuals who fall are within 40 to 64 years old. Does that surprise you? That kind of surprised me the first time I heard it many moons ago. So what causes the patient to fall? Often it's anesthesia. And I've laid witness to that. I've worked on different campuses at Advent Health, but I worked on the surgical progressive care unit at Winter Park. We had many falls because maybe the guy's in their 45, elective surgery, everything's all well, but then he forgets that he's under the effects of anesthesia. And how many of you have had anesthesia and you're like, ooh, seem a little bit loopy. But also thinking about it, you're in an unfamiliar place. How many of you went to a hotel and all of a sudden you wake up in the middle of the night to go to the bathroom and you're like, where am I? The same thing happens when you're in the hospital. And any obstructions in the pathway, like cords. So kind of that periphery. Maybe they forget they're connected to O2. Maybe they forget they're connected to the IV. So those little things like that. But yeah, we do an awesome job for our elderly population. Bed alarm for everybody. You know, we're very vigilant. The younger people, we might not necessarily be in the hospital as often. But that middle-aged population, they often forget their limitations. They're not hospitalized as much. They're kind of the caregivers. So just keep that in mind that I always like to assume every patient that walks into that hospital is a fall risk because they're not feeling well. So never leave a patient unattended. I can't stress that enough. A lot of our falls occur in the bathroom. And when you think about the bathroom, it's kind of a risky area. Porcelain, very scary. So a lot of times you may say, hey, but what happens if they want their privacy? I've been there where you're like, just give me my privacy, I'll pull the cord. Of course you want to give them privacy, but you always want to be within eyesight and if they should fall, you're there. So you could close the door a little bit, but you want to still be able that you're within eyesight and that you're keeping an eye on that patient. So keep that in mind. Do not leave them unattended. And that's including the commode too, because all of a sudden they try to stand up, they fall, and then you're like, uh-oh, I may have caused this patient to have a fracture of some sort. So we're gonna play a game. So we have different codes here at Advent Health. So the first one is a code white. Does anybody know what a code white entails? So this one's gonna be an active shooter or violence. In my experience, I've only heard it once. But I don't want you guys to freak out if you hear code white or you hear nurses saying code white. There's a whole process that goes with it. What about code red? This is an easy one. Fire. So if they say code red, they'll specify the exact location of that code red. So you might be on clinicals and you might do a code red drill. So what does that entail? So it's kind of a fire drill. So you're going to help with the nursing staff to close all the patient room doors and any areas. Any of the corridors, you're going to remove any stretchers, IV poles that shouldn't be there in the first place, but you're going to make sure it's nice and clear. What about a code pink? Child abduction. So what happens with that is they'll overhead page code pink and they'll specify the description of the child or the infant, and the staff members will go to any exits and kind of guard it and kind of screen people for that. What about code blue? Yeah. So for adults or peds, and they've gotten really good on specifying it. So maybe you're doing your clinicals at Advent Health Orlando. They'll specify code blue, adult patient room 5814, or they'll do a code blue pediatrics room blah blah. So they'll specify that because there's different teams and different methods of resuscitation that you'll do. What about code black? Scary stuff. What about code yellow? I know this gets the hard ones. Prepare to evacuate. So just for whatever reason, unfortunately, we live in Florida, where weather's unpredictable. There might need to be some sort of evacuation, but hopefully you guys don't have to entail this because usually, they'll have some sort of inclement weather plan from the school. So you shouldn't be going to clinicals in bad weather. But just keep in mind, we never know what could happen with our weather. Code green is going to be evacuation. And then code orange is going to be hazardous materials. So different codes, you're not going to be tested on it, but at least you have some awareness if you hear the lingo. And I forgot to tell you, Advent Health, we like to use different acronyms and lingo, so keep that in mind. So code red. So what do you need to do for fire safety? So we use the acronym RACE. We're going to remove the persons in the area. We're going to activate the fire alarm. Makes sense. We're going to close all their doors and then evacuate the area. So as student nurses, you're not going to be responsible for conducting this, but do follow whatever instructions the unit does give you because we want to make sure that everybody is safe. But let's say for whatever reason, you're right by the fire extinguisher and you see the fire. You're going to do something called pass. You're going to pull the extinguisher, you're going to aim, squeeze, and sweep. Hopefully you don't have to encounter this, but we want to set you up for success. Waste streams. So let's say, for instance, you're helping out with a med pass, or you see all these different contraptions. So any sharps, so completely delivered syringes, any needles, you're going to use the sharps container. These are found in each and every patient's room. And they also have it like in the soiled utility, other areas as well. And they are locked, so patients can't go in with that. So that's your sharps container. Purple box. So that's for any pharmaceutical waste. So this is going to be in the soiled utility as well as in the med rooms. So let's say, for instance, you hang your IV piggy bag, you're like, yay. You're not just going to put it in the trash. You're going to put it in this box. And I tried looking online for a box. I just probably have to get a picture of it so at least you could vision it. If this is going to be for any IV bags, vials with drug left in them, syringe with ointments, or anything that has IV bags or syringes with chemo. And this does not include controlled substances. Controlled substances, we have another process. But as student nurses, you're not touching any controlled substances. But you might observe your nurse doing that. Yellow box. This is going to be for anything that contains chemo. So just keep that in mind. If you see this yellow box, don't touch it, please. But your nurse could explain to you what that entail. Red bag. So this is one that you probably see often. So this is for blood. So does it contain blood? Any blood saturated items, bags, IV tubings, hemovacs, chest drainage, hemodialysis products. So at Advent Health, we're really conscientious that we don't want to create any hospital-acquired pressure ulcers, or now they're transitioning to HAPIs, hospital-acquired pressure injuries. So we use something called the disposable underpads. So a lot of you may have seen the ones on the right, the linen underpads. So they're fine and dandy, but I don't like them because let's say for the patient, has an accident. It's cloth. And what happens with cloth? It just sits there. It's saturated. And we do a good job with our hourly visits, but we might not necessarily be there the moment they have their accident. So we instead use the premium underpads. And this is going to be for our high-risk patients. Maybe they're bedridden. Maybe they have malnourished. You're like, over the course of time, they're going to be at some sort of high risk for developing pressure ulcers. We use the pads instead because they're absorbable, they breathe. So another rule of thumb, you only use one. Because if you put two, I've been guilty of that, you put two, oh, Mr. Smith keeps on going, I'm just going to be proactive, it defeats the purpose. Because then it's the same exact mechanism like the underpad, the cloth one. So just keep that in mind. So getting started. So a lot of you are like, you went through a lot of stuff for, regulation stuff, which is all fine and dandy. But how do I become successful, right? So, like they said, you're going to be badged right after this presentation, so definitely smile. But the badge, and then you'll be able to get an op ID as well as a PIN and how to sign on to Cerner. Cerner is the computer charting system that we utilize at Advent Health and go from there. So let's say, for instance, you're on the clinicals and you're like, I kind of want to know what their policies and procedures are. So from a hospital computer, you could go on our Advent Health Connect, which is kind of our intranet, and there's a place called Advent Health Policies and Procedures. Click on there, you'll have access to all policies and procedures at Advent Health. So it might be a little bit different than what you may need for class, but at least if you see a process and you're like, that's a little bit different than what I learned in school, you can refer to that to know, oh, okay, this is hospital policy, or a lot of times in lecture they might say, well, refer to hospital policy, depending on that. So just keep that in mind. So this is a super important screen, so I want you guys to write down some of these key components. So once you get on the hospital, you're going to be given your op ID, which is your username. And you're like, that's great, but your initial password to log into the computers is going to be, and this is all one word, number 1, lowercase the rest, new body, all one word.
That's what you gotta write down, guys.
Yes. So your op ID and then your password is going to be 1, new body, all lowercase. After that, it's going to prompt you to change your password. And we know with passwords and technology, you have 5 million passwords and you have to make all these passwords that make no sense and then you forget. Story of my life. So after you do your 1 new body, it's going to prompt for the password. It has to be at least 8 characters long. Much better than the requirement that we had for years, which was 7 to 8. This one's at least 8 characters long and must contain 3 of the 4 character types: uppercase, lowercase, numbers, or special characters. You guys are very familiar with this process. You could be like one of my students last week, or this past Sunday, she put all 4 characters. I was like, no, you just need 3, but whatever you could do, just remember it's something easy for you to remember. And then you're going to confirm your password. You would have to change your password every 90 days, but don't worry, start of every clinical semester, you'll have with your clinical instructor to help with the process again. So let's say for whatever reason that doesn't work, which, it's technology. For any password resets after you try to do that at your Florida hospital computer, you could call 407-303-8000. That's AIT. They are awesome guys and gals. Give them some love, but they'll help you out because they are awesome with that. But when you call to change the password or do anything with your account, they're going to ask you for your op ID, but as well as your PIN. So that's that 4-digit number that you'll be receiving. So if you see PIN, you're like, is that a debit card? It's kind of an extra security code, so just keep that in mind. So let's say, for instance, you're having difficulty with technology. Your first point of contact will be your clinical faculty. They'll talk to Dr. Wei about any access issue, but there's always AIT, and they're available 24/7. So let's say, for instance, you're doing your practicum, it's 2 a.m. in the morning, you're like, I have no access, they could help you out. So keep that in mind, we always want you to be successful. And you'll get your very sophisticated Advent Health badges with your app ID. They don't look like that. So parking, this is super important. Don't worry about writing this down, but just know that there's designated parking for each of our campuses. And some of you are like, oh, that sounds silly, but most importantly, we want the closest parking for our visitors and guests. Yeah, kind of makes sense. So definitely, when you do go out to the hospital, your clinical professors will designate you on which parking you have to be at, okay? So the way in which we provide care should be guided not only by technical knowledge, but also by our understanding of others' experiences. You're going into a remarkable profession. It's a lot of hard work. But you guys are change agents. You are our future of nursing. Just keep that in mind, that remember always that there's a human element to nursing. People will forget what you said, people will forget what you did, but people will never forget how you made them feel. So keep that in mind. It's super important. So thank you again for your active participation, and I hope you enjoy your clinicals. I can't wait to see you guys, and I might see you guys as part of my clinical students, so be nice. Do you guys have any questions? Okay. How many of you guys are doing your clinicals at Advent Health? Awesome. If you're not, it's okay. But yeah, you guys are going to have a great time. Just keep that in mind. In any clinical arena, whether you're at Advent Health, Orlando Health, Central Florida Regional, the VA, you're an advocate for your learning. So just keep that in mind. You make the experience as great as you put it in. So we will wait for any final questions. No worries. Okay. Thank you so much, guys, again, and best of luck. You guys are in excellent hands.